The ECS is considered the master regulator of homeostasis, or balance within the body. Now, the question is, how do we target the endocannabinoid system? How do we bring about that rebalancing process? Hello, and thank you for joining me on this Cannanda product training. My name is Lee No, and I am the co-founder of Cannanda, as well as the lead for product development and scientific affairs. I fully appreciate the fact that this is your personal time, and there are a lot of other things that you could be doing right now, and instead you're here with me, and I appreciate that. After this session, I hope you're going to walk away with some valuable information that you can use to better help your customers, maybe even yourself. So let's get started. I'll start by talking about the endocannabinoid system, or the ECS. And this is because this is a system that our products primarily target, especially our CB2 products. Now, the ECS is often considered the master regulator of homeostasis, or balance within the body. It's an anciently preserved system. It's the system we have in common with all vertebrates. Not only humans have it, but dogs, horses, and probably even dinosaurs, for real. And its role is to bring things into balance when they go out of balance. So when a tissue or an organ or a system in the body is going towards a disease state, the endocannabinoid system jumps into action to start that rebalancing and kickstart that healing process. When there is a dysfunctional ECS, that's when we start heading down the road of degenerative diseases. For this reason, targeting the endocannabinoid system is often a critical aspect of health maintenance. Now, the endocannabinoid system is made up of three main components. First are the cannabinoid receptors. Then there are the endocannabinoids. So these are fatty acid compounds that activate our cannabinoid receptors. And then there are enzymes, and the enzyme's role is to break down the endocannabinoids once they're finished doing their job. The question is, how do we target the endocannabinoid system? How do we bring about that rebalancing process? Well, we do this through the activation of certain receptors. There are a number of receptors in the endocannabinoid system, but the two main ones that we talk about are CB1 receptors and CB2 receptors. Now, CB1 receptors are the ones that are predominantly found in the central nervous system, so the brain and the spinal cord. And when we activate CB1 receptors, we actually feel intoxicated. So this is often the receptor that we're talking about when we think of recreational use of cannabis. CB2 receptors, on the other hand, are predominantly found in the periphery, so outside the central nervous system. Its main role is to bring about all sorts of different health benefits, often associated with an anti-inflammatory effect. So by targeting the CB2 receptors, we can bring about a lot of the health benefits and the medicinal effects associated with cannabis without the intoxication. And this is the goal from a therapeutic point of view. Now, when we activate those CB2 receptors, we get this anti-inflammatory effect. And that is going to have a number of different benefits related to things like pain reduction, improvement in mood, as well as all sorts of other benefits to degenerative conditions. The question we often get is, does the brain have CB2 receptors? Historically, we thought that CB2 receptors were only found in the periphery, but the newer research actually shows that we actually have a lot more CB2 receptors in the brain than what we once thought. Now, this is important to understand because when we start targeting things like anxiety, mood disorders, Alzheimer's and other forms of dementia, seizures, multiple sclerosis, things like that, we want to be able to target the CB2 receptors in the brain. I'll also make a quick mention about the immune system, because the immune system is the system in our body that is most densely populated with CB2 receptors. And it's also intricately involved in the inflammatory process. So this is the connection between inflammation, the immune system, and how our products work. I also want to emphasize that there are quite a few studies related to CB2 receptor activation and Beta-Caryophyllene, which is the main ingredient in our CB2 products. And if you go to our website, you'll see a fairly comprehensive list of studies that have been done with respect to all sorts of different organ systems, body systems, and health conditions. So I encourage you to go to our website, take a look, because I think you're going to be able to connect and resonate with a number of them. A lot of the studies will revolve around Beta-Caryophyllene and CB2 receptors' anti-inflammatory role. So you're going to see a lot of studies related to pain, osteoarthritis, which is inflammation in the joints. And talking about joints, you'll see studies on rheumatoid arthritis. Now, rheumatoid arthritis is an autoimmune condition. The body's immune system is overactive and attacks our own body. So the idea from the perspective of the endocannabinoid system is when we target those CB2 receptors, we can actually tone down an overactive immune system. So this relates to not just rheumatoid arthritis, but all the different forms of autoimmune conditions like multiple sclerosis. Essentially what we're trying to do is just tone down that overactive immune system. There are a lot of studies with respect to diabetes, obesity, and metabolic disorders. We've heard a lot of incredible testimonials. The great thing is that when you target blood glucose and you're able to manage blood glucose, you see a lot of knock-on benefits. So when we activate CB2 receptors in the pancreas, for example, we're able to improve insulin secretion. When we target the CB2 receptors in the target organs, like the muscles, we actually improve insulin sensitivity. I'll give you a really cool story with one of our previous sales reps. So this is a sales rep that joined us and started taking our CB2 products. Within a month, he said he lost 20 pounds. And this is a person that didn't change their physical activity, their diet, their lifestyle, or anything. Everything remained the same. The only thing different was adding our CB2 products to his diet. And within a month, he lost 20 pounds. Now, that's an incredible result very quickly, but not surprising when you look at the studies that have been done with respect to blood glucose and weight management. The other cool thing is he mentioned that his craving for alcohol dramatically decreased. And again, that's corroborated by the studies that have been done on substance use disorders. So studies have been done on alcohol intake. A lot of studies have actually been done on food addiction, but studies have also been done on smoking and nicotine, as well as cocaine, etc. So there's a lot of studies that confirm that what he was experiencing was due to the activation of CB2 receptors. Anxiety is another one that's been studied, and likely one of the main reasons why people use our CB2 products. And essentially what we're seeing is that when we have brain inflammation, our bodies respond by developing these anxious tendencies. So if we can reduce the amount of inflammation in the brain, keep in mind that Beta-Caryophyllene, the main ingredient in our CB2 products, does cross the blood-brain barrier. Not many substances can do that. So when it crosses the blood-brain barrier, it's able to activate those CB2 receptors in the brain, tone down that brain inflammation, and therefore we are able to relieve those anxious tendencies. This also means that activating CB2 receptors in the brain has all sorts of benefits to neurodegenerative conditions. And I know that's a big umbrella term that covers a lot of different conditions, but what we're seeing is that we can improve situations like Alzheimer's and other forms of dementia. Actually, Alzheimer's, I want to take a moment to give you a really cool testimonial here as well. So a number of years ago, I did a public presentation at a store, and a lady, after that presentation, bought our CB2 hemp seed oil and our CB2 wellness blend and gave it to her mom, her mom was experiencing severe Alzheimer's and had actually developed seizures secondary to the Alzheimer's. And she was in a long-term care facility. Her condition was continuing to worsen. She started to administer our CB2 products to her mother, and she said within about 3 weeks, her seizures stopped. And after about 3 months of daily use of our products, her Alzheimer's condition had improved to the point where the long-term care facility actually suggested maybe she doesn't even need to be here anymore because she was self-sufficient. What's interesting as well is that at that time, her brother suggested, well, if she's better and she doesn't need these products anymore, maybe we can stop giving these to her. So the family decided to stop giving the CB2 products to their mother, and she claimed that within about 3 weeks of stopping our products, the seizures returned. So it's a clear example that this was not by chance. It was actually our products delivering the benefits. I know Alzheimer's is a horrible condition and a lot of people are developing this. So definitely something to consider if you have customers who are developing Alzheimer's or if their older family members are developing Alzheimer's. Multiple sclerosis has also been studied. Other neurodegenerative conditions like Parkinson's, seizure disorders have all been studied and found to benefit from CB2 receptor activation. Cardiovascular health is another big umbrella term that covers a number of different health conditions, and they've all been shown to benefit from the activation of CB2 receptors. What's really interesting is that in the ideal situation, you want to be taking products like ours prior to any sort of cardiovascular event, like a heart attack or a stroke. And the research has shown that if you're priming these CB2 receptors prior to those events, you can actually reduce the size or the area of the damage from those cardiovascular events. The research also shows that using our products after those events can speed healing and result in a fuller or more comprehensive functional recovery. You should be taking our CB2 products preventatively, but absolutely after any sort of cardiovascular events as well. The digestive system is not often a system that people think about when they think about our CB2 products. Gastrointestinal tract is the area where the bulk of the immune system resides. The immune system is the area of the body where that's most densely populated with CB2 receptors. And so it makes sense that when we activate those CB2 receptors, we're going to get benefits to the digestive system as well. And again, that's exactly what the studies are showing. We can actually reduce the hypermotility associated with things like irritable bowel syndrome, and we can reduce the inflammation associated with inflammatory bowel diseases like Crohn's and colitis. Skin health is another area that's been studied, and a lot of people are starting to use our products for beauty benefits. And what the studies have shown is that not only can activation of CB2 receptors speed the healing process, so anytime we have a cut or even from post-surgery procedures, activating CB2 receptors can speed healing. But the other cool thing is that it can also reduce fibrosis or scar formation. So again, we're speeding the healing process while minimizing the scar formation. We also see studies with respect to respiratory health. Studies have shown that we can reduce the fibrosis in the lungs with respect to nicotine damage. We can also ease asthma and allergic asthma. Migraines have been studied. A lot of people and a growing number of people use our products for migraines, not only to prevent migraines, but also to treat migraines. And we also have a lot of really cool testimonials with this. Actually, I'll give you the example of a person we know that had migraines ever since she was a child. And as an adult, started getting Botox injections to control her migraines. After using our products, a combination of the CB2 hemp seed oil and CB2 wellness daily, she has now been able to stop taking her Botox injections, and she's able to control those migraines just with our products alone. Another story is, this comes from our sales rep, one of our sales reps who just finished a product training at a store, and every staff member got a vial of our CB2 wellness. After the training, when she came back to the store on her next call cycle, one of the sales staff actually chased her out into the parking lot, gave her a big hug, and was literally in tears thanking her for the vial of the CB2 wellness. And that's because she's had migraines all her life. She tried everything. Nothing has worked except the CB2 wellness. So when she got a sample of our CB2 wellness, with her next migraine, she decided to take a couple drops sublingually. And she said the migraine literally stopped in its tracks. And it's the first time she's had anything work for her migraines. So of course, these are quite powerful testimonials. And of course, I can't say that everyone's going to get this response, but we've had so many people report similar stories that if you have a customer coming into your store, it's certainly worth a consideration. Liver health is another one where studies have shown that we can reduce the fibrosis or scarring of the liver, so things like cirrhosis. We can also reduce the risk of things like non-alcoholic fatty liver disease and other liver disorders. So again, there are a lot of studies listed on our website. I encourage you to go check them out and find those studies that are going to benefit your customers.